Welcome. In this video, we'll be discussing the differences between systematic and scoping reviews. My name is Catherine. I'm the reference and instruction librarian for the Levy Library, and I'll be walking you through these differences, what they are, why they are, and what questions you should ask yourself when trying to determine which review type your research question falls into. By the end of this video, you'll be able to explain the key differences and similarities between systematic and scoping reviews, identify which review type aligns with your research question using a 3-point criteria, as well as clue words or phrases. And then lastly, apply this into the real world with your own research questions. Starting off with similarities, both systematic and scoping reviews follow a structured, transparent, and reproducible process. Both require you to define your research question and assemble your team, conduct a preliminary search of the literature, develop a protocol, design and execute a comprehensive search, followed by screening the studies or study selection, risk of bias assessment, data extraction and data synthesis, and then lastly, writing the final manuscript. You'll notice that for scoping reviews, a risk of bias assessment is shown as optional, and we'll discuss later why that is. As I mentioned, the process is very similar between both review types. There are minor differences. For example, both systematic and scoping reviews require a protocol to be developed. However, where the protocol is uploaded differs. Typically, a systematic review protocol is registered with Prospero, which is a formal registry for systematic review protocols. Whereas scoping review protocols will often be uploaded in an open repository like the Open Science Framework. Similarly, both review types require a comprehensive search of the literature, but they do differ in terms of the amount of literature that gets pulled. Systematic reviews will oftentimes have a smaller number of results versus scoping reviews, which may include a larger result set. Where the major differences tend to come in is the type of question that you are asking, the synthesis of findings, risk of bias assessment, and the goals of each review type. Let's look at each of these major differences in a little bit more detail. Starting off with the research question, whether you're doing a systematic or scoping review, one of the major differences is the type of question that you are asking. There are several research question frameworks out there that can help you develop your research question. However, for today's session, I'm focusing primarily on the PICO and PCC frameworks, as these tend to be the most commonly used ones. Beginning with systematic reviews, PICO is a framework that tends to get used, and it's made up of 4 major components. First, who is your patient or population of interest or problem? Second, what is the intervention or exposure? Another way I like to think about this is, what are you doing to the patient, or what are you exposing the patient to? Third, are you comparing the intervention to something? You could also decide that you don't want to compare it to anything at all. And then lastly, what is the primary outcome of interest? If we take a look at an example, we have here, in patients with sickle cell disease, does hydration decrease pain? With sickle cell patients being our population of interest, hydration being our intervention, and decrease in pain as our outcome of interest. Here, I've chosen not to include a comparator just to keep it simple. You will notice that with systematic reviews, you're asking a very specific research question, usually on how something directly or may affect a particular outcome. A scoping review, on the other hand, uses what's called the PCC framework. Similar to a systematic review, you want to ask yourself, who is your patient or population of interest? Or again, it could be a problem. What is the concept, which refers to the core concept, idea, or issue that is being examined? This can include elements that you may see in systematic reviews, like the intervention, outcome, phenomenon of interest, but at a broader scale. And then lastly, what is the context in which you are looking at this in? By context, we mean what setting. So for example, an inpatient setting, are you looking at a particular geographic setting like the United States? If we also take a look at an example here, we have what hospital guidelines have been implemented to manage pain in patients with sickle cell disease. With sickle cell disease patients being our population of interest, implemented guidelines for pain management as our concept, and the hospital as the context or setting. You will notice here that scoping review questions are more exploratory in nature. They're still quite specific, but generally somewhat broader than that of a systematic review. If we take a step back for a moment, if with a systematic review, you're looking to see how an intervention affects a specific outcome, with a scoping review, you're usually looking to map the literature rather than looking at a cause and effect relationship, which is why outcomes are typically not present. If this is still confusing, it will make more sense once we talk about the goals of each review type, as both the question type and goal are often intertwined. So in essence, the goal will put the nature of the research question into a little bit more perspective. Starting off with systematic reviews again, the goal is to assess effectiveness of an intervention on a particular outcome or comparing interventions. So for example, is drug A more effective than drug B? Identify consistent and or conflicting findings, assessing quality of existing evidence. And it's not included here, but another big part of systematic reviews as well is informing clinical decision-making and recommendations. A scoping review, on the other hand, the goal is to identify characteristics or factors related to a concept, clarify key concepts and definitions, examine how research has been conducted on a given topic, and then another really big part of scoping reviews is locating gaps in the literature. Overall, if we were to place these goals into wider baskets, with a systematic review, the overall goal is to inform clinical practice, which can include clinical decision-making or policy-making, whereas with a scoping review, the overall goal is to map the literature and identify gaps in knowledge or trends. Now, the direction of your research question and goals of the review in many ways will inform what the rest of the review process will look like, one of which includes the risk of bias assessment. When discussing risk of bias, we're typically referring to the process of assessing the validity and reliability of a study by evaluating its methods and results. With a systematic review, a risk of bias assessment is mandatory. Why? Well, like I mentioned in the previous slide, the overall goal of a systematic review is to inform clinical practice or decision-making that will ultimately affect people's lives. As a result, you want to identify and eliminate all potential biases in studies that affect those results and ultimately healthcare decisions. While a risk of bias assessment is mandatory for systematic reviews, it is optional for scoping reviews. And this has to do with the exploratory nature of scoping reviews. With scoping reviews, you aren't really looking to draw specific conclusions, determine cause and effect relationships, or making recommendations based on its findings, but rather mapping the literature to identify trends and gaps. This means that you can include a wider range of evidence than you would a systematic review, making a risk of bias assessment less feasible. In many ways, the type of question you are asking and the goal of the review may or may not impact how you approach synthesizing the evidence. With a systematic review, typically a quantitative synthesis or meta-analysis is conducted. A meta-analysis is where you combine all of the results of multiple independent studies to come up with one single conclusion. This makes sense when you consider the fact that, as we said earlier, with systematic reviews, we are usually looking at a cause and effect relationship. In order to conduct a successful meta-analysis, you need to have studies that address the same research question and have similar variables that you can pull from. Usually, when we're talking about variables, we're talking about outcomes as well as other factors like gender, age, etc. If the variables are too different to pull from, then a qualitative or narrative synthesis may be more appropriate. Of course, you can also decide that a narrative synthesis works best based on your goals and what you're looking into, regardless of whether there are similar enough variables for you to do a quantitative synthesis. So you don't need to do a meta-analysis. You could decide that you want to do a narrative or qualitative synthesis instead, which is also fine. With a scoping review, though, you're usually analyzing the results in the form of a narrative synthesis. Why? Because again, the goal of a scoping review is to map the literature, and in that process, you're looking at trends, gaps, any discrepancies, and that means that the variables are going to be too different to be able to even do a meta-analysis in the first place. There are different types of narrative synthesis, with thematic analysis being one of the most common ones, which analyzes text for patterns or themes. Now, I do want to dive away from the four major differences for a moment to talk about the differences and similarities in guidelines that get used for both review types. For both systematic and scoping reviews, we have reporting guidelines, which refer to a formal checklist that provides authors with essential items that need to be reported in the final manuscript. There are also guidelines that are not reporting guidelines, but they're sort of like handbooks or guidelines that walk you through the process of how to conduct a systematic and scoping review. Both reviews use PRISMA guidelines, which is the primary reporting guideline for systematic reviews, with PRISMA creating a separate checklist for scoping reviews named PRISMA SCR. Now, in addition to PRISMA, systematic reviews also have what's called MOOS guidelines, which can be used to report the meta-analyses of observational studies. So, if you're doing a systematic review and it's primarily focused on observational studies and you plan on conducting a meta-analysis, then you would use MOOS to report the meta-analysis and what you did. Scoping reviews, on the other hand, in addition to PRISMA, have the JBI Manual of Evidence Synthesis, specifically Chapter 10, as Chapter 10 focuses on scoping reviews, as well as the ARCSI and O'Malley framework. The similarities between these guidelines is that they are there to emphasize transparency, reproducibility, and comprehensive reporting of the process. Usually where the differences lie is, again, those differences in just how to conduct certain parts or certain steps of the review process. Now that we've taken a look at some of the similarities and differences between systematic and scoping reviews, it's time to reverse roles here and have you think about how this might apply to your research question and determining whether your research question falls in line with a systematic review or scoping review. To do this, we're going to use 3 out of the 4 major differences that we discussed earlier as our criteria for determining which review type may be more appropriate. So you want to ask yourself, does my research question fit the PCC or PICO framework, and do I have an outcome of interest? Another way to think about it as well is asking yourself, are you looking at a specific research question related to cause and effect, or are you looking to explore what is out there? Another way to also think about it is, are you looking to draw a specific answer or a specific conclusion? Second, you want to ask yourself, what is my goal? Are you looking to inform clinical practice or map the literature? And then lastly here, how do I plan on synthesizing the evidence? This is going to depend on various factors like the research question, the goal, and what you see in the literature. The best way to show you what this looks like in a real-life context is by using a scenario. So here I have a scenario, and we will use it to determine whether it falls more in line with a systematic or scoping review. You'll notice that I chose a scenario and not a research question because I find that most often than not, people won't have a fully formed research question, but they will have somewhat an idea of what they're hoping to look into. So going straight into our example here, it says, you are an ophthalmologist looking to write a review paper on the impact of the nasal spray varenicline on dry eye disease. Specifically, you want to see how good varenicline is at alleviating signs and symptoms of dry eyes. You've heard of both systematic and scoping reviews and are unsure of which is more appropriate for your question. You're hoping that this paper can give clinicians the confidence to recommend or prescribe varenicline for patients who refuse standard treatment options, for example, eye drops. So we're going to use our 3-point criteria here to determine whether this is a systematic or scoping review. So starting off with our first criteria here, does the research question align with the PCC or PICO? The answer here is PICO. Why? Because we want to see if varenicline is effective at reducing symptoms of dry eye disease in patients, symptoms of dry eyes in patients with dry eye disease. So here we have a very specific population of interest, which is patients that have dry eye disease. We have our intervention, which is varenicline, and we have a very specific outcome of interest, which is to see if this intervention is going to reduce the signs and symptoms of dry eyes. Whereas with a scoping review, it's actually a bit too narrow to fit the scope of a scoping review. If we wanted to know, for example, what the effects of varenicline is, then this would align more with a scoping review because we don't really know what those effects are necessarily. So this will fall more with PICO. If we look at our second criteria, how will we be synthesizing the evidence? This also again falls in line with a systematic review. If we wanted to, we could do a quantitative synthesis or a meta-analysis. Because we're looking at the effectiveness of varenicline, this means that we're going to be pulling a lot of primary literature, and the same goes for virtually all systematic reviews, which can be used to quantify effectiveness. Of course, like I said, this could also be a narrative synthesis if you want, but if we wanted to do a meta-analysis, we could just sort of based off of the question that we're asking. And again, this means that this wouldn't be a scoping review, although, like I said, if we wanted to do a narrative synthesis, we definitely can. And then lastly, what is the goal of this review? Again, this falls in line again more so with a systematic review. If we go back to our scenario, we will see that the goal is to give clinicians the confidence to recommend or prescribe varenicline for patients who refuse standard treatment options. So in short, we're trying to inform clinical practice rather than mapping the literature. So again, this will be a no for a scoping review because we're looking for a very specific answer here. So based on our criteria here, we can confidently say that this falls more in line with a systematic review. Now let's look at another example here. So here we have, you are part of a group of medical educators interested in exploring the impacts of simulation-based training on cardiac life support skills and self-reported confidence levels among internal medicine residents compared to standard lecture. The goal is to understand the range of available evidence, identify how these training methods have been studied, and how students respond to these methods to inform future research and curriculum design. So we're going to do the same thing with our last example. We're going to use our criteria to determine if this is a systematic or scoping review. So first, does this research question align with PCC or PICO? Well, this example aligns more with the PCC framework. If we were to try to put this question into PICO format, while we do have a population of interest as well as an intervention and comparator, we don't really have an outcome of interest. We're also looking at the impact of simulation versus standard lecture, rather than assessing if simulation is more effective at improving cardiac life support skills. The term or word impact can mean many things. We aren't really looking here for a specific answer, but rather explore what is out there. Again, if we look at our second criteria, how exactly will we be synthesizing the evidence? Because we are looking at impact, a narrative synthesis may be more ideal because we can analyze trends in resident experiences, performance, and responses for both interventions. This flexibility means that there is going to be a lot of variability in terms of results, making it less suitable for a meta-analysis. And then lastly, what is the goal of our review here? This also aligns more with a scoping review because the goal here is to understand how students respond to simulation for curricular development. While you could argue that the goal of informing curricular design is more in line with a systematic review, and it definitely can be, we aren't really looking for a specific answer here. So again, based on our criteria, we can confidently say that this is a scoping review. If we look at one more example, we have here, you are a medical student working with a dentistry faculty member on a project about dental health and patient care. Together, you've noticed that patients with severe dental phobia often avoid or struggle through appointments, which can lead to worse oral health. Your mentor has asked you to investigate the techniques currently being used in dental settings to reduce anxiety. You want to look at a wide range of possible interventions to help guide future patient care recommendations and overall improve oral health. Again, using our 3-point criteria, does this research question or example align with PCC or PICO? This aligns more with the PCC framework. While theoretically, we do have an outcome of interest here, which is to reduce anxiety, reduce fear, we don't have a clear intervention of interest. We're just looking to locate all techniques and how that may potentially reduce dental phobia. So how will we be synthesizing the evidence? Our second criteria here. Because we're looking at all techniques or interventions, a narrative synthesis is more ideal, as this will allow us to compare and contrast techniques, see how they affect dental phobia, and identify any trends and gaps. On the other hand, for systematic reviews, the fact that we are looking at all interventions means that there's too much variability to be able to conduct a meta-analysis. Lastly, what is the goal of our review? Again, this aligns more with a scoping review. Our goal here falls more in line with this because we're looking to understand what interventions exist and potentially even inform future care recommendations. Again, similar to the previous example, you could argue that informing care recommendations aligns also with a systematic review, which it does. But again, we aren't looking for a specific answer here. So similar with our last example and using our 3-point criteria, we're looking here at a scoping review. Now, stepping outside of our criteria for a moment, another way to determine if your research question falls more in line with a systematic or scoping review is by using clue words or clue phrases. So if you were to explain to someone what you're investigating with this review, and you find yourself using terms like causality, risk, evaluate, measure, assess, or inform, then you're likely looking at a systematic review. In contrast, if you're using terms like map, describe, gaps, define, characterize, explore, trends, then you're likely looking at a scoping review. If we return back to our first example on varenicline and dry eyes and dissect it for clue words, we see here that we want to see how good varenicline is at alleviating signs and symptoms of dry eyes. How good is referring to effectiveness, and alleviating is looking at a direct outcome, which is the thing that we want to measure. Then finally, the term recommend or practice or prescribe closely aligns with decision making. These terms let us know that this is leaning more towards a systematic review. If we apply this to our second example on simulation-based training, we're looking to explore the impacts of simulation-based training on cardiac life support skills and confidence levels in internal medicine residents. The term explore already indicates that we want to see what is out there or map the literature. And impact may refer here to effect or influence, which is quite broad because, again, impact can mean many things. Lastly, the goal is to understand the range of available evidence. The phrase understand the range solidifies that we want to map the literature. We aren't looking for a specific answer here. We just want to see what's out there on the effects or influence of simulation-based training versus standard lecture. These terms indicate that, or phrases as well, indicate that we are leaning towards a scoping review. Now, to wrap up, systematic and scoping reviews share the same rigorous foundation, but their purposes differ. Systematic reviews seek to evaluate how effective something is, or again, looks more at a cause and effect relationship, whereas a scoping review seeks to explore what is out there. When determining which review type your research question falls under, ask yourself, does my research question fit the PCC or PICO framework? And do I have a specific outcome of interest? What is my goal? And how do I plan on synthesizing the evidence? You can also use the same 3-point criteria to reframe your research question to the opposite review type by having you think about the things that you may need. So for example, if you find that your research question is more in line with a scoping review, but you really want to do a systematic review, you can use a 3-point criteria to help you narrow down your scope. Then lastly here, you can use clue words or phrases to determine which direction your question is leaning towards. So again, if you're looking at terms like, or words like effective, inform, measure, assess, that's probably a systematic review. And if you're using terms like define, map, explore, trends, gaps, et cetera, then you're likely looking at a scoping review. Now, with the examples shown today, you may have noticed that there are a lot of nuances here. The idea is not to turn you into experts per se, but rather have you think about these things in advance before you push forward with conducting a systematic or scoping review. Of course, if you have any questions or need help with determining the scope of your research question, if you need help with which review type your research question falls into, please don't hesitate to contact us at refdesk@mssm.edu to set up an appointment.